Thanks everyone for being here at the December Walk Massachusetts Network meeting. I'm going to turn it over to our speaker for this month, Elizabeth Maldari. Elizabeth?
Thank you. Thank you, Brendan. I'm Elizabeth Maldari. I'm very excited to share the work that we're doing in the Merrimack Valley. And I just, I want to say that Walk Massachusetts has been really an integral part, and I was so happy to be connected with them at the beginning of this process. And now it's like coming full circle, probably almost today when we first met. So that just feels really nice. And I'm going to share my screen. Please let me know if you have any trouble seeing it. Just hold on a second. So, okay. So do you see the my share screen? Okay, I have a little, oh, there it goes. Okay, I had something kind of coming over it. And also I have the possibility, it looks like, to have the, because I have two screens. So I think I should be able to see if anyone has a question and raises their hand. Just use the raise your hand feature, and then I can try to keep an eye on it, or feel free to interrupt verbally if you like. And we can pause and talk about it, but there will be a Q&A at the very end of the presentation as well. Okay, so yeah, I'm Elizabeth Maldari. I'm going to present on the Merrimack Valley Vision Zero plan. And just for anyone who's not aware, Vision Zero is a commitment to 0 deaths and 0 injuries. And because we're presenting in the Merrimack Valley and the plan is for the Merrimack Valley, this is specifically a commitment for 0 deaths and 0 injuries on Merrimack Valley roads by the year 2050. Right, and this is me. So I work for the Merrimack Valley Planning Commission, which I'll talk about in just a moment what that is. But I'm the Vision Zero project manager. I also do public participation and engagement. So the public participation plan is a federally required document that all planning organizations are required to have. And I would recommend for sure that we just published ours. So if you're in the Merrimack Valley, you should be able to view it on the Merrimack Valley Planning Commission website, and I can drop a link to at the end of the presentation. But it's outlined how you can participate, and I know that there are certainly people who feel that there's a lot of barriers to participation, and that was something that I experienced too initiating this project. And so we're working to understand better how to break down some of those barriers and get more public participation, because it really is important, and it really drove this plan in a very positive way when it happened. And then we're also initiating an age-friendly transit committee with our partners at the Regional Transit Authority, NEVA Transit. So if there is, I heard that there were some people from the Merrimack Valley here in this call. And if you are interested in joining our committee, please reach out to me. That's my email at the bottom of this. And that's something else maybe I can write it at the end. I can share again too my contact information. So about the Merrimack Valley Planning Commission, we're a regional planning organization that addresses 4 major topics. So it's community and economic development, environment, transportation, and that's the program that I'm in, and then geographic information system, often referred to as GIS, which is basically mapping. So if you've ever been curious about where conservation land is, or maybe some of your wastewater systems, things like that, it's often mapped through GIS, and it helps our municipalities and other groups access the spatial organization of our communities. So that's something else that we provide a service to our community in the Merrimack Valley. And this is just the map of where that is located in Massachusetts. It's up, I know it's kind of tiny, but you can kind of see where it's located up at that northeastern region right on the New Hampshire border. It encompasses 15 communities. We have 5 commuter rail stations, and it's between the Haverhill line and the Newburyport line. We also have a regional transit authority that serves almost all of our communities with fixed route service. And then there's a couple more rural places where we haven't extended it yet, but you can still access it through like a paratransit service. And there's really a spectrum of different communities. We have cities, and then we also have very rural communities. So it's an interesting region to work on safety, because you have a lot of very context sensitive areas that you have to work and kind of adjust some of those plans. And I'm going to just talk a little more about the Vision Zero plan, how we got there. So this is how we're funded. Basically, it was from the bipartisan infrastructure law. There's the Safe Streets and Roads for All grant program. Merrimack Valley Planning Commission was awarded a planning grant in 2022 to create a plan that would consist of creating the high injury network, so that mapping the crashes and the predictive analysis, as well as identifying what the strategies and priorities are for our community to achieve a vision of zero fatalities and severe injuries. And then there's also a supplemental planning and demonstration grant that some of our communities have been awarded. So within our region, there are certain municipalities that have continued to program additional safety work that they use our plan to guide, and then they can do different projects that are like quick builds. So you might see some temporary things going up to trial out different ways of making the streets safer. And then there's also an implementation grant, and that's a much more competitive, but really higher amount that you can get to do larger permanent changes to infrastructure. So why are we applying for and why are we working on safety in our region? So this is the trends of severe and fatal injuries in the Merrimack Valley. And this is what is typical for me to look at day to day, is more data and numbers heavy on the crashes. And I want to also just to reiterate why it was so important to work with advocates, and why I really do appreciate the partnership with Walk Massachusetts as well as Walk Bike Andover, and I'm so happy that Andrew's here, but other organizations, because it's easy to sit at your computer and you get all this data coming in from, this is from MassDOT, and ultimately they're kind of collecting all of the crash data from our police departments and then putting it into a chart. So you look at, okay, the trends in severe and fatal injuries, it's declining for the drivers, it's increasing for passengers and vulnerable users. But when you get into the more human factor, I mean, we're looking at, that's still 80 people per year at the minimum in our region who are experiencing a life-changing injury or dying on our streets just from trying to get from point A to point B. And then very alarming is that the rate of vulnerable users and passengers, so somebody who's in a car, is increasing. And I don't have all of we would need to do a much deeper dive into that data to understand why the passenger rates are increasing. But I do want to highlight that, this isn't like a good news situation. Oh, look at the drivers are declining. I mean, it's such a high impact. And this is something that, why this is so urgent at this time, that we see huge steps and measures to prevent these fatal and severe injuries from continuing to incline. We want to see them hit zero. And there's some strategies that we're embracing to do that, and that's outlined in the Vision Zero thinking and mindset. So in a traditional approach, which is, sort of historically how transportation planners and engineers might go about designing or improving roadways, they would look at traffic deaths as inevitable. It's a side effect of this basic human need, and we try to mitigate them, but it's going to happen. Vision Zero is looking at it completely different. It says that traffic deaths are completely preventable and unacceptable. Then in a traditional approach, we might expect that there's perfect human behavior. In Vision Zero, we would design for human error. And I think a good way to illustrate this change is that probably most of us in this call may have learned to drive defensively. So it was really like, oh, drive as if everyone around you, might make mistakes or is out to get you. And that's okay, but I think that there's something to be said too about, on the other side, to try to design defensively. So we know that, and this is kind of this other one, individual response, or sorry, just about perfect human behavior. We know that people will make mistakes, and wouldn't it be a more caring transportation system to create these buffers and safety implementations so that when those mistakes occur, the penalty is not death? I don't think that that's a very realistic consequence for what could be a very small mistake. And then I think that, just continuing down this list, in a traditional approach, we would look to prevent all collisions and looking at all collisions the same versus Vision Zero, where we're really preventing fatal and severe crashes. A small scratch that happens to my parked car because it's on a tight road is not the same as repeated injury crashes occurring at a wide unsignalized intersection with poor visibility, where you know that there's going to be vulnerable road users walking across. And so these things need to be weighted in a very different way. In the traditional approach, we would look at individual responsibility, whereas in Vision Zero, we try to emphasize more of a systems approach. And I'm going to get into that in just a second in the next slide, because it's kind of a bigger topic and branching of this initial discussion. And then in the traditional approach, saving lives is expensive, whereas in Vision Zero, well, it's really not expensive if you consider the cost to our communities when you think about like, oh, we just can't avoid that there's people dying in the street because of unsafe roadways. So this is just an extension of that traditional approach and looking at the system. So we have a whole roadway system, and that includes people, there's vehicles, the speed limits, the roads, and then if there is a crash, what's the post-crash care look like? And I'll just go around this chart, and then in the next slide, we'll look at how we could kind of disrupt some of the status quo. So in a traditional approach, again, the responsibility is on individuals to be perfect. We say cars only protect the drivers, and really there's not a lot of regulation for any vehicles that are being sold today to protect any of the vulnerable road users on the outside. So we have some backup technology, we have some increased visibility around, but really there isn't necessarily a regulation about that. And then we have speed limits. So speed limits are set based on the 85th percentile of driven speeds on those roads. And there's kind of a good and a bad thing about that, because when the roads were initially designed, and in our region, they were probably either cow pastures or the most commonly walked path to church from the villages, and we have a lot of churches were really where established the town centers. Basically, you are then paving over these roads. We've got high volume streets transversing that are made to accommodate a large number of vehicles, and they're not necessarily designed for slow speed to go down a town center. They're designed to prioritize the efficient movement of vehicles. And so when you measure those speeds in the state of Massachusetts, you need to look at what the speeds are already being driven on the roads, and then determine the speed limit based on that. And the problem is that if you just lower the speed and you put a sign up, you're not really changing how people are going to drive. If there's a 25 mile per hour speed limit on a street that was designed to go 50 miles per hour, more likely people are going to go over 25 miles per hour without even noticing it, because it's comfortable to drive on that street in that way. And so when we collect the data, we're going to say, okay, well, the 85th percentile shows people driving 45 miles per hour. And then in the roads, just on that note, we haven't historically designed roads to prioritize safety. Often the performance measure for roads is that they move people efficiently. So what's the fastest way that we can get the most amount of vehicles, not people, but vehicles through our roadways? And with post-crash care, I came across this very interesting document that was written in the 90s predicting what the next century would be for safety technology. And I thought, oh, that's great that they were looking at it. And the safety technology that they illustrated was really just focusing on medical advancements to trauma care. So it wasn't mitigating the crashes from the beginning. And this is a document from Federal Highway. It's actually looking at, oh, well, we're making so many steps to advancements in medical care and technology. The crash will occur and people will get hurt, but we're going to be able to save them and mitigate the effect of the crash at the very last stage of what would, all the preventative measures you could take to get to avoid a crash, but we're just focusing on advancements at the very end of that. And so thinking about that as like this projection into the future and what we're doing now, which is the safe systems approach. So here we're really looking to empower vulnerable road user advocacy and human-centered design rather than looking at just individual responsibility. So this is more of a shared responsibility, and to emphasize that there's vulnerable road users who also use our roadways, and we need to advocate for their safety, not just to say, okay, well, it needs to be perfect and it's okay that there's not a bike lane. Bikes need to, it's on them, their individual responsibility to be safe. And then here with the vehicles, we're not just looking for cars to protect the people inside the vehicle. We're really advocating for crash mitigation technology requirements and to right-size vehicles. The fact is that cars are getting heavier and more dangerous for people getting out of the vehicles, or sorry, outside of the vehicles. So I'm worried about being injured if I'm in a crash because my car is too small. I'm going to buy a bigger car, but we can't endlessly grow the size of our vehicles. We really need to look at more right sizing and moving in another direction where it's more about buying the appropriate size vehicle for the road. And that's something that I'll get more into because we have a breakdown of strategies, but just generally it is important for us to look at what do we have available in the technology, and then also how do we encourage all drivers to think about right sizing their vehicles. Then also for speeds, we need to look to design the roads for the desired speed and not just what can the road accommodate for the fastest speed possible. And then also prioritizing in our roadway design the safe movement of people. So roads are not only for cars, they're for all mode types. And we know that if we don't create connectivity and pathways for people who are riding their bikes, who are walking, then we're putting those people at more risk, not just because they don't have a designated space, but because the roadway basically is not designed to accommodate them. And it's in our area where, especially on more rural roads, people are not even imagining that there could be somebody biking or walking because there's no accommodations for those built into the roadway. So there's no signal that mode conflict would even occur. And then finally, with this post-crash care, we shouldn't be relying only on medical advancements to trauma care, but really we need to support first responders, mitigate secondary crashes, and then plan efficient routes to the hospital as sort of the last but important stage in the process. So I'll talk a little bit about the type of engagement that we did in our region to start to craft this plan, because it was, obviously from the beginning, we wanted to understand from people who live here, who use the roads every day, what kind of difficulties and barriers they saw to achieving a vision of zero injuries and fatalities. So we did meet with, we had an appointed person from each municipality. They were all different backgrounds. So there were planners, Department of Public Works, police, and other types of first responders. And then in some cases, either the town manager or the mayors were appointed. So we had different breakout sessions with those groups to just understand from their perspective, from the staff perception, how do we make these changes and what are the barriers that they're facing? And then we looked at crash mapping. So asking all of the municipal liaisons to share with their communities a crowdsourced crash map so people could identify on their local roads, where do they have the most safety concerns, and then what type of concerns do they have. And we found that excessive vehicle speeds and unsafe turning movements, so certain intersections where the roadway characteristics made people feel unsafe for various reasons, were the two that came up the most. So it was very insightful to kind of think about how that aligned with what the crash data we were seeing on the other side was. And then also having discussions with advocates. So we had a roundtable with some of the local advocacy groups who are already making steps towards improving safety on their local roads. How can advocates be part of this planning process, and how can we structure our final plan document to support their needs and the information that would be helpful to continue their work? We had 5 walk audits with support from Walk Massachusetts, as well as from residents and nonprofit there were a couple other nonprofit organizations who joined, and then municipal staff, so we could see some of the worst intersections from the vulnerable road user perspective. And then we also had safety design events that were more about designing the roadways that we want to see. So what does a roadway network free from fatal and severe injuries enable for our communities? And we heard a lot of different ideas that I think in these sections were really where it started to take shape what would be possible, because it ranged from people saying, well, I would like there to be less social stigma for me to be walking. Oftentimes, if I'm walking on a place that I know is dangerous, someone might stop and ask, like, why are you walking? Because there's no sidewalk, there's no accommodations, but it's that's their primary mode of transportation. So it could be that, there's a expression of fear or concern, but really it ends up being a bit of an isolating experience and creates stigma around just being a vulnerable road user out in public. And then other people also responded saying that the cost of their car insurance was so high because of how high the crashes were. And so they were trying to look at, how there are certain communities where people are paying, if you move from the town of North Andover to Lawrence, for example, your car insurance goes up because there are more injury crashes in Lawrence than there are in North Andover, and that goes into the overall calculation for what they were paying for their car insurance. And so things like that. So there was a whole range, but it was helpful in these safety design events to really make that tangible. What would people like to envision? And the outreach insight, this is not a real term. I don't think I just made it up to explain that we were also showing up to if there was a community doing a complete streets program, or if there was any kind of public hearing around safety or roadway designs, we would show up for them. And so it became very important to not just have people come into us, but also to show up for the work that the communities were already doing around safety. And this is a map showing where how we distributed different engagement activities. The little colorful polygons, not the red ones, but the layer you see underneath that, those are showing we call them regional environmental justice plus communities. So these are census designations that are assigned to different, it's not the whole municipality, but it would just be like one neighborhood designation for people who are most likely to be burdened by any changes in the transportation network. So the different categories here would be disability, income, limited English proficiency, non-white, and zero vehicle households. So if these different neighborhoods had meet a certain threshold for having a population that meets one of those criteria, or multiple criteria is often the case, then we really wanted to hear and target those communities specifically because they would be the most impacted likely by any changes that we made. They would probably have the best ideas for how we could mitigate crashes because they're participants in that transportation system, that local transportation network. And we really tried to focus the most of our engagement within those communities while also reaching as many other communities as we possibly could. And then after we finished the plan, we had a World Day of Remembrance for victims of traffic violence. And this just happened on November 16th. And this again was really an eye-opener. Remember that last slide, or the slide at the beginning showing the data, and it's just showing the different numbers of crash injury by mode type. So I had been working on the plan and I had been drafting this up, and then knew about World Day of Remembrance, knew we wanted to do something to honor the victims and also to raise awareness about the plan. And I had received a call from Emily Stein, who works for the Safe Streets Alliance. And she said, well, we've noticed that Methuen has had, it's overrepresented for fatalities. They've had quite a few this year. I think it had already been 4 by the time she got in touch with me. And that would be a good place to host the World Day of Remembrance event. And so we brainstormed about what would be the right materials. And I had heard from some of the family members of some of the victims of the fatalities that they would want to honor the way that they lived, not the way that they died. And so I think that for sort of speaking to there's a lot of different ways that communities honor those victims. And I was thinking about that, okay, how do we send a message of safety and support and love for our community, and keep this vision alive rather than just as a memorial to the violence that occurred. And so we had this idea to have flags that people could paint, and they're quite large, as you can see. And I thought, okay, well, we can put them in the Methuen Rail Trail, which gets a lot of traffic, even in the fall. I mean, it's really beautiful. So I called the Methuen Police Department about it and learned that in the time between initially calculating the number of fatalities in our region, and this was like the course of a week, there had been 3 additional fatalities that Methuen Police Department had to respond to. So 2 of them occurred in Methuen and 1 was in Andover, but because their police department was the closest dispatch, they were the ones that responded. And so the officers had, because of this happening, they were like 2 days in a row, they had been put into stress management. And I just think that it's important to underline that this is part of that cost and the high cost of what's happening, and the urgency of this, the urgency of Vision Zero really becoming a reality is just, we're not seeing a lot of the hidden costs. I mean, obviously, when there's a fatality and the community mourns, I think it's felt, but I don't think that it's as present, what's going on with our public health services and the stress that it's putting on at all different levels of the communities. This was a really amazing event because we had so many people walking past that didn't even know about it, and no one turned us down to paint a flag. And everyone who showed up also had a story of traffic violence, either as somebody who said, well, I was driving the other day and something really scary, I didn't even see the road line, and it was raining, and so I went off the road. And there was other people who were saying, oh yeah, like I was on my bike and something scary happened. So it was really made it so clear how prevalent this is and in the whole region. And I think that it's something that we're continuing to work on. We didn't paint all of the flags because in total there have been 94 deaths since 2020. So we're looking to paint nearly 100 flags to represent all of the fatalities in our region, and then we'll hang them up somewhere. So we're still working on that. And if anyone's interested in painting a flag and you live in the Merrimack Valley, please do get in touch, because I would be happy to coordinate with you and have you participate. And then I know I'm running a little bit over, but I'm going to just quickly go through the high injury network and how we created our prioritization plan. So first we looked at the trends-based high injury network, and this looks at 3 weighting where the injury crashes have occurred based on 3 criteria. So the crash severity, if it was a fatal injury, it would be weighted higher than if it was a severe injury, which would also be weighted higher than if it was a minor injury. Then if it had vulnerable road users, so that's that VRU involvement, that would be weighted higher as well, because it would mean that there's more likely that there will be vulnerable road users in the future, and we want to make sure that we mitigate and prioritize vulnerable road user access. And then also if it took place in one of those regional environmental justice plus communities, we know that they're severely overrepresented, especially pedestrians. The RAJ plus communities make up 10% of the geographic space in our region, but are 60% of the pedestrian injuries and fatalities. So this is really an important community to target for pedestrian improvements. And then we also had the risk-based high injury network, which we had help and support from Beta, and I'm happy to see that some of our consultant members are here. So they put together a risk-based high injury network using a predictive analysis that looked at the average daily volume, road width, and posted speeds, along with a lot of other, those were the main criteria, but there are a lot of other roadway characteristics that contribute to the predictive analysis. And then you can see that the 2 maps are pretty similar where there's clustering. One location I want to identify is up in, if you look in the top, the northeast corner, there's Amesbury and Salisbury. So in the predictive analysis, Salisbury has much more, has been identified to have a much higher risk than in the trends-based high injury network. And then also this one corridor that's all in blue going through Salisbury ends, and then through Amesbury is slightly less. And that's because the speed is lower in Amesbury than it is in Salisbury. So it's small things like that that could really affect the risk, the predicted risk. And we created some, based on all of the data collected, we created strategies for safety. So looking at how, what were the perceived barriers that people identified through our engagement, and then how can we change the policy or process to improve that and to address those barriers? So for safer speeds, some of the barriers that we heard is that there's not enough police staff capacity to enforce the roadways, and that there's also a public relations issue. So it's not, there's a conflict anytime that there's a traffic stop, there's an opportunity for conflict. And really the goal here is to reduce conflict at traffic stops, to promote equitable enforcement, and then also to look at, what's the funding opportunity? Because if you get a ticket, a lot of people would say like, oh, they're trying to meet a quota. There's too much opportunity for there to be inequitable assignment of tickets or traffic stops. And so we're looking to track and support automated speed enforcement efforts and advocate that the revenue that's collected by automated enforcement would be dedicated to roadway infrastructure and safety projects within the region or the area that they are collected. So basically, automated enforcement is not currently legal, but it is a legislation that's up right now to be approved. And so we would like to support it. But in our region, we would also advocate that if there is a traffic automated enforcement in any community, that needs to, the funding needs to go back into the community to improve their community development or safety on the streets. And then this is just a quick chat to look at, or sorry, quick chart that just shows how different speeds impact the risk of death, and underlining why speed is such an important part of our mitigation strategy. I know we're kind of close, so I'm just going to quickly go through these. Safe streets. The barriers here that were identified is that there's not enough safe access to bus routes, that there's lack of safe facilities and connections for pedestrians, a lot of instances where the sidewalk will just end and suddenly you're walking on an unlit shoulder or no shoulder. And then also a lot of people, I should put this in quotations, are like, no one walks to school anymore. And we're like, well, part of that is, I think, a fear, because we're seeing increase in pedestrian fatalities. And so how do we get people to walk and to be more comfortable? Well, we can support multimodality by identifying and eliminating sidewalk gaps on existing high priority active transportation corridors. The safer vehicles, I think we talked about this briefly. So I'm going to just show you this picture. So our Regional Transit Authority installed these mirrorless mirrors. They found that they had a lot of blind spots on their buses, and obviously a bus, it's a pretty big vehicle. So now there's additional cameras on the sides and set on the back of the bus high up so that they can really see all around the bus, and it also will alert them if there is a car approaching. The technology doesn't currently alert them for bikes. It's not sensitive enough, but the idea is that now at least they'll have an improvement in the visibility and use these. So we're advocating that they apply them to all of their entire fleet. And then also, because the walk audits were such a hit and we really got so much out of them, we're looking to invite our communities to submit walk audit requests, and that we would execute no fewer than 4 per year. And I know that some communities have already reached out to us. So this has been really important, just because I think it's a way to help people who really just want to get involved with safety advocacy, to be part of it without needing too much technical expertise, because we're really walking around and just discussing what the problems are and how could we make improvements. So it breaks down some of those barriers to the in the chain of communication. And then finally, safety data. So we've created this portal that maps out the high injury network. And again, this was with a lot of support from our consultant Beta to create this tool, and then also so that people can look at the travel mode and injury type in their community. So if they're curious about a specific intersection and want to learn more about the circumstances leading to a crash, they can use this dashboard to access that. And these will all be released at the end of this year. I'm going to skip this because they're just more about the local projects, but with that, thank you so much. And I did try to go as fast as I could, but I had a lot to say about
I
this
think that was
topic.
fantastic. No, that was excellent. So thank you so much, Elizabeth. I'm going to stop the recording and we'll open it up to Q&A.